So I'm talking today, I am Susan by the way, not Karri, I'm Susan. And I'm the Senior Primary Care Nurse working at Southern Cross University Health Clinic. And I'm talking to you today about how we've developed nurse network meetings for Northern New South Wales and Mid-North Coast. So in about 2015, Southern Cross University was approached by the then Medicare Local, which then transformed into the PHN. And they wanted us to partnership with them, and there were two objectives. One was to develop nurse networks from Tweed Heads to Port Macquarie, so it was quite a large footprint that the North Coast Primary Health Network had. And the other objective is they wanted me doing the work, was to develop a graduate certificate in primary healthcare nursing. So they obviously told us from their data that they had a significant number of practice nurses working in GPs across the region, and that 70% of these practices had at least one practice nurse working with them. They said that they were committed to supporting primary healthcare nurses, and so I was really excited and motivated to be able to be a part of this and try and develop and set these networks up. That didn't really come out very well. So how I went about it? Well, the first thing I did was I engaged with APNA and the lovely Murphy Woods, who was a great support and guided me on how to set up these nurse network meetings. She gave me lots of tools and resources, one being the Nurse Coordinator Toolkit. And she also gave me a survey, which I then gave to the project officer at the North Coast Primary Health Network, and we adapted some of those questions to get the information that we needed. But we wanted to know who was interested in attending a nurse network meeting, so whether it was worthwhile setting up, and what they wanted out of these nurse network meetings. So we're really gauging interest. And some of the results that came back from that survey is that 70% of the nurses that responded were working in general practice. So how interested were they in joining the local primary care nursing network? Well, there was 85% were interested, so they're either somewhat interested or very interested. But interestingly, the 14% that were neutral sent back comments like they didn't really know what this was, they didn't really know what this nurse networking meant, because it was a new model of connecting primary healthcare nurses across settings, rather than us nurses going to an event that the PHN or the Medicare Local would put on. So there were a few people, and there's still some people that are not really sure. They still think it's a CPD event rather than a nurse networking event. So some of the outcomes of this survey that we sent around in the development of these networks, obviously 20% of the nurses in the region completed the survey, that was 85. As just mentioned, 70% of those nurses were working in general practice. 81% of the people that responded to the survey were registered nurses, and we had strong interest in people attending the network, so we knew it was good to go ahead. We asked a question about who was interested in coordinating the meetings, and that was because it was a really large footprint. So from Tweed Heads to Port Macquarie is a really large geographical area, and I couldn't be across all those regions. So what we needed is we needed a champion. We needed a local nurse coordinator in each of those regions, and 19% came back saying they would be interested, and we were lucky that we did get one local nurse coordinator for every region. And so I oversaw their work and was a connection for them in setting up the nurse networks in those regions. And we also asked another question. We wanted to know whether they were interested in using some sort of online tool in between meetings. And 92% came back that they were interested. In a little bit of the research that I did, I looked at, there were some groups, I think the PHN in Southeast Sydney were using a Facebook group for their Nurses Connect, and Gold Coast Primary Health Network were using an online nursing forum. So that was interesting. Karri will talk to that later. So what did they want? They wanted continuing professional development, clinical updates, and they wanted updates on local and local health issues, referral pathways and service updates. I don't know about your areas, but particularly in the area on the North Coast, our referral pathways change frequently depending on funding, and as a nurse it's really hard The services change so often, it's really hard to keep on top of that. So these nurse network meetings provided an opportunity for that for these services to come in and let us know what they were doing, what their services provided, and how we could refer our patients into them. So in May, this was bearing in mind I was writing the graduate certificate at the same time of developing these networks. So in May we set up the nurse network meetings across the 4 regions, and unfortunately the very first one I could not attend because I was actually in labour. So I didn't get to that one, but I got to the other ones. I was absolutely devastated. I did all this work and I couldn't be there for the first one. I was actually labouring, literally. So they went, the areas that they were, as mentioned, Tweed Heads, Northern Rivers, Hastings Macleay and Mid-North Coast nurse networking. So the purpose of the networks was to connect with other nurses working in primary healthcare and just to move away from our silos. So often we would be sharing the same patients with nurses working in community health or nurses working in drug and alcohol, yet we didn't really talk to each other, and it was really nice setting up these network meetings to be able to see a face to a name and just to break down those barriers. We also wanted to increase professional knowledge and to be involved in quality improvement and health improvement systems. And also the networking meetings allowed us to increase leadership capability. One of the nurses that was the local nurse coordinator for the Northern Rivers, for Lismore, a lovely nurse called Eniko Donach, had no public speaking experience before. She was absolutely petrified. But she has led those network meetings all through 2017, now into 2018, and has really been able to increase her leadership capabilities through that. And the nurses also told us that they wanted quarterly meetings, which is why they were 4 times a year, and that they wanted them to be nurse-led, but that was the whole purpose of them. So in 2017, in May, August and November, we had over 350 primary care nurses attend, and the feedback that we got, so everyone was asked to fill out a feedback form after every single nurse network meeting so we could plan for future meetings. The overall feedback was very, very positive, 96%. So at the end of the year, myself and the project officer, who was Siobhan Breeden, needed to provide an executive summary to the executives of the North Coast Primary Health Network. And the main point to them was that the key success of these meetings was that it was nurse-led, local coordinators in the region, and that it was the nurses that advised the North Coast Primary Health Network on the meeting strategy and format rather than the other way around. So some various styles of meetings. So one meeting we had like a speed dating style of meeting, so where we were looking at sick day action plans. So we had the people that were coming in that were promoting their sick day action plans. Instead of them talking to the nurses spent 15 minutes with each person and they speed dated around the room. That was one style. Another style was a more formal, where they sat down and had a dinner, and the person that was delivering their referral pathway and health service update spoke to the room. So that was one of the key successes. Out of the summary that we gave to the PHN was that we believed that a more formalised role needed to happen, and they employed 2 clinical advisors to continue these meetings in 2018. And I'd like to, Karri is one of those people, but the other person I would like to pay tribute to, one of the nurse coordinators and the other successful applicant of the clinical advisor, and that was a nurse, a lovely lady called Moira Moran, who was the local nurse coordinator for Port Macquarie. She was also successful in becoming one of the clinical advisors for Hastings Macleay and Mid-North Coast. Unfortunately, Moira was diagnosed with ovarian cancer in November last year, and sadly she passed away on the 22nd of March this year. So Moira is dearly missed, and may she rest in peace. And I'd like to hand over now to Karri on her role and how these meetings have continued.
Thanks for that, Susan. So I'm a practice nurse, and I was employed from the meetings my role came about, so thanks again, Susan. So one thing I've found is that the nurse network meetings are a fantastic way to get feedback from the practice nurses, both verbal and with the surveys that we gather. And this data has actually influenced quite a few things. For example, we know ongoing throughout the meetings that these nurses are interested in the online forum. We know that they're interested in the graduate certificate. And of course, it means they have a say in the topics for the next meeting and the meeting after that. For instance, we're doing wound care next week. That's been like the most requested topic. Practice nurses love wound care. And so they're really just a great way to give practice nurses a voice. And it's a unified voice, everyone's in it together. Another interesting thing is that we've been getting a fair amount of interest from allied health. Physio, pharmacy, paramedics, they've all been asking to start coming to these meetings. And I always say, yeah, because I think this connected education across the sectors will ultimately improve the patient experience and help give patients a clear and standardised education. I'll be getting the same messages from different settings in regards to things like referrals and best practice for their chronic wounds, and because we've all been in the same room together. And I think it gives practice nurses recognition from these other providers as well, because they're sitting down and hearing about what they do, and so how do we enhance the capacity of practice nurses into the future, and maybe eventually create better billing numbers, nurse specific? I think we need to support practice nurses to show they have the skills and credentials to function as experts in certain fields, as they already are with immunisation and these chronic disease clinics. So the graduate certificate in primary healthcare nursing, thanks to Susan and the other team members, is starting hopefully in August in Lismore at Southern Cross, and there'll be 4 units beginning then. And the PHN is giving 5 scholarships to nurses in our footprint to further their education. So I have contact details if anyone's interested. Come and see me after.
It's online.
And it's going to be online. But the scholarships are within that postcode of which is a really big postcode from Tweed right down to Port Macquarie. So some of you might be from there. So another thing that I've been working on for the Nurse Network meetings is a online Nurse Network group, and it's a free online platform. It's supposed to be starting next week, opening up before the next Nurse Network meeting. So the forum's been set up and will be driven by local nurses working in primary healthcare in our footprint, and it's a private group page to hold relevant discussions about healthcare matters, to share ideas with other nurses, local events, join a discussion, and there should be links to good online CPD education opportunities and different events. So there's a feedback link that will be on it as well, so that gives nurses another opportunity to drive the content, and a resource library. So we're looking at wound care with our next meeting, and I'll be able to put up some learning packages that are evidence-based from QUT, Wounds Australia, and it's all about just hopefully keeping it in this one place that you can access in your own time, and it'll be local and nurse-driven. So they're just a few of the projects that have come from the meeting. There's more I could go on, but the main thing is, I think, that the nurses just really love the meetings, and the feedback we get is overwhelmingly positive. And I think it's really reduced that isolation that you can feel when you're working in a practice, especially if you're the only nurse like I was. So coming to these meetings was just a great way to connect with other nurses and chat. So thanks very much.